Hello, and welcome to today's episode on subjective voice complaints. In this video, we will be covering three popular tests that we have used in our research: reflux symptom index, voice related quality of life, and voice handicap index. We have made two Cochrane reviews, one on hoarseness and one on reflux, where at the time nothing was found with optimal evidence, which is double blinded prospective randomized controlled studies. The purpose of this video is to help distinguish between tests using subjective complaints. We will discuss the pros and the cons of each, and if eligible, which one could be used routinely. Jamie Kaufman's Reflux Symptom Index. Laryngopharyngeal Reflux Index includes very good questions, and in our randomized controlled studies of treatment, this test illustrated significant reflux. Therefore, this test should be used in patients. It is a subjective evaluation made by the person, him or herself. Laryngopharyngeal reflux is involved in up to 50% of clinical throat symptoms. The questions are precise and easily understood by the patients. It is possible for an individual to evaluate her or himself, and if necessary, make the according lifestyle changes. Of the three presented questionnaires, this is the only proven with randomized control trials. The fine part is that a test using subjective complaints works well in the clinic. While the reflux symptom index is a good test for evaluating, it is not updated in a way that we can use in the future. The paper from Francis et al. Is interesting because it focuses on patient-reported outcome. Even when it comes to subjective complaints, the patients are very seldom involved in the evaluation, and when they are, the validity is weak and without clear interpretability and scaling. For a long time, evaluation of hoarse persons was limited to listeners, and the value hereof has been questioned. Haderline et al. Described an automatic evaluation as a valuable instrument in evidence-based clinical practice. The future will show if this is possible on a greater scale. Voice-related quality of life is used a lot in the UK and includes subjective complaints. The problem with the test is it must be related to some kind of objective finding, and at best also some kind of treatment. We have used it to test two different approaches of voice treatment. Quality of life is a huge area to be further evidence-based. It is a test for many areas. Voice-related quality of life is just a small part, and as such, it often doesn't cover the entirety of the patient's issue. With development and understanding of the brain, it is not specific enough for documentation of treatment effect. It has had its use since it at least describes some complaints that patients might have in so-called non-organic voice disorders. There was a time when this was a relevant test, but as times has developed, the subjective tests have reduced value. For example, most non-organic voice disorders are microorganic disorders based on allergy, infection, provocations from surroundings, and reflux. It documents improvement and should be treated as such. It only shows any changes in symptoms the patient might find. It must at least be accompanied by some test of functionality. Voice handicap index questions are divided into three subcategories: functional, physical, and emotional. Historically, it was thought to be a good division, but it is controversial and subject to many discussions and corrective suggestions by professionals. A special form for singers and other groups has been made. There are many questions involved, and there are so many versions of it. No randomized controlled trials has been made. There is a fine introduction in Phoniatrics 1 on perceptual assessment of voice quality, for example Grabbers, and an overview of reflux diagnostics. Again, thank you for watching, and we'll see you in the next one.